Come in.
Good morning. My name is Makia, and I'm one of the nurses on the unit. I was asked by the provider to come in and speak with you this morning. Can you need the name and date of birth of your son?
His name is Nico Brown, and his date of birth is 04/14/2014.
Thank you, that matches. I was asked to come and speak to you about your new diagnosis. Is now a good time?
Yep, this is all so new. I like that very much.
I know this must be overwhelming now, but hopefully I can help with alleviating some of the anxiety. First, can you tell me what you know about sickle cell anemia?
The doctor came in and told me it was some type of anemia that changes the shape of the red blood cells that carry oxygen.
Thank you. Well, that needs some clarifying. So let me see if I can explain it a little better.
Okay.
Sickle cell anemia, or sickle cell disease, is a group of inherited red blood cell disorders. A severe hereditary form of anemia in which a mutational form of hemoglobin distorts the red blood cells into a crescent shape at low oxygen levels.
In other words, it has to do with red blood cells changing shape.
Yes. Let me give you an example. Normal red blood cells look like this circle. With sickle cell disease, their red blood cells are distorted, so they're twisted, and it begins to block the flow of cells through the blood vessels.
It's starting to make sense. Can you tell me some signs and symptoms?
Some signs and symptoms of anemia are pallor or ashen skin in melanated skin tones, tiredness, they're easily fatigued, shortness of breath, irritability, and a decreased hemoglobin level or loss of appetite.
Okay, that explains a lot about what he's been feeling.
Now, I want to place a big emphasis on the next piece of information we're going to discuss.
All right, should I write this down?
I will be providing you with a handout with some information we're going over. But if writing it down helps, then yes, go ahead.
Okay.
Sickle cell crisis is a crisis of a flare-up of the disease. It lasts between 3 to 14 days. A vaso-occlusive crisis is the most common form of anemia crisis. It occurs in more than one location, so you can have a flare in your legs, your abdomen, chest, or lower back.
Some causes of the crisis are dehydration, infection, stress, strenuous physical exertion, extreme fatigue.
Oh, so you've done a little bit of research.
Yeah.
Often when this type of crisis occurs, it requires an inpatient hospital stay. Exacerbated symptoms during a crisis is the time of when you should call your primary care provider or your on-call nurse. Chronic symptoms can cause organ damage in children, and they are at high risk for infections and impaired kidney function.
That was a lot to take in, but I'm realizing there's much to know about this disease. What about the medications?
The typical treatment of this disease is to pain management, is to control the pain. The MD usually prescribes a few medications. Here's a pamphlet that I brought in to discuss with you. The medications used for treatment are L-glutamine, which is used to slow down the damage from the sickle cells. Some side effects of that medication are nausea, fatigue, chest pain, and bone or muscle pain. They also prescribe pain medication. So for milder pain, you'd have Tylenol or ibuprofen. For more severe forms of pain, you'd have to go to the hospital where they'd probably increase or change the medication to medication such as oxycodone or morphine. There's also another medication called hydroxyurea. It's used to reduce the painful episodes of chest syndrome, which helps blood cells stay round and more flexible. Some side effects of that medication include loss of appetite, constipation, and headache.
If I have questions, is there someone I can call?
Yes, I will give you a listing of your provider's numbers, and there's on-call numbers for nurses that can help as well.
Well, I think I've learned a lot, and this information has helped clarifying what exactly is happening to my son.
I'm glad I was able to help. I will continue to follow up with you on your next well visit.
Thank you very much.
You're welcome.